KP's Video News, baby. You know what time it is. KP's Video News.
That's right. It's time for KP's Video News. And we're going to hit you with it, with the real. And here, this article here was got a couple of articles I'm doing here, and this is on health, on black health, and some issues that we suffer from, and that we really need to start thinking about, because it's some true health hazards. So with the first one, I'm going to get into it right away. It says a new study shows racism may shorten black Americans' lifespans. So African Americans who reportedly experience with racial discrimination are likely to age faster, adding to the evidence that racism is not only a social and moral dilemma, but it also is a public health issue. According to the study by Auburn University, encountering racism can lead to higher levels of stress, which in turn causes cells to age more rapidly. The adverse health effects of racism on African Americans are well documented, but the Auburn study focuses effects on pieces of DNA that protect cells. The results show a link between increased experiences with racial discrimination and more rapid shortening of those cells, indication of cell aging. Our results point to how racial discrimination, a particular type of social toxin that disproportionately affects and impacts African Americans, becomes embedded in the cellular level. Wow. Nearly 400 African Americans from Birmingham, Alabama, Chicago, Minneapolis, Oakland, California participated in the study, which began in 2000 and was published in the journal Health Psychology. At the time the study began, they were 40 years old on an average. Sarah Carter, psychology professor at Georgia State University and the leader of another study on racism and aging, published in September, said the Auburn study results are in line with the growing body of research on the role racism plays in lowering life expectancy for African Americans. She said that over time, experiences with racism and even chronic worrying about it can cause significant wear and tear by increasing one allostatic load. The lifelong buildup of stress, which accelerates aging and puts African Americans in a greater risk for chronic illnesses. If we start thinking about racial discrimination as a chronic social stimuli, it fits in with all our models, both medical models and psychological models, of what happens when your body is never able to reach a balanced state, she said. Your body is trying to find that balance, but it isn't able to get there because stress continues to happen. Carter's study looked at how the stress of racism can lead to accelerated aging in African American children, while the Auburn study focused on middle-aged adults. But the results, Carter said, point to the same conclusion. Racism effects on the mind and body warrant further exploration. According to Auburn's study, participants experience racial discrimination on the street or in public more than anywhere else. The two next most common settings were in the office or while trying to get hired. Carter said that one practical response of the growing body of research on racism, aging, and chronic illness would be for health services institutions to recognize that racial sensitivity is an essential part of ensuring healthy outcomes for a diverse patient pool. Just like we are having things like trauma-informed care, I believe we need to have a racism-informed care, she said. Racism continues to be a pressing social issue and moral dilemma, as well as a public health issue. Carter agreed and added that Americans' inability to recognize behavior or treatment that is racist only contributes to those public health issues. Her prescription, open and honest conversations about race. Our society has a long history of difficulty addressing its past and present racist practices. She said what prevents things from happening is people have these fears of what doing something racist means about them personally, when really a conversations need to be had. People are dying because of this. Wow, that's deep. That's real deep right there. And this next one here, you have people diagnosed with high blood pressure or high cholesterol often let heart healthy habits slip after starting treatment with this prescription drugs. A new study has found in that analysis, they discovered that people who took cholesterol or blood pressure lowering medications were more likely to reduce their activity levels and gain weight over time than those not on the drug treatment. Medication shouldn't be viewed as a free pass to continue or start an unhealthy lifestyle. People who are starting on medication should be encouraged to continue or start managing their weight, be physically active, manage alcohol consumption, and quit smoking. Heart healthy lifestyle habits like exercise and a balanced diet are always recommended, whether or not blood pressure or cholesterol medications are prescribed. Each participant was given 2 or more surveys in 4-year intervals between 2000 and 2013. The surveys assessed physical activity, alcohol consumption, and smoking history. The researchers also obtained pharmacy data if they began taking their prescribed high blood pressure or statin medications, characterized medication use on those who began preventative medications between the start of the study and a 4-year follow-up surveys in those who did not start the medications. Compared to those who did not start the medications, the researchers found that those who did were 8% more likely to become physically inactive. They also noted that those on the medication were 82 times more likely to become obese and have increase in body mass index. The researcher noted because of public health initiative as well as variations in the habits of participants such as smoking, the cessation of which can affect weight gain, and the lack of specific information on participant diets, the result of the study may not be broadly generalized. But they say the research suggests that many slack off in lifestyle habits when they start the drug treatments for high blood pressure and cholesterol. And as a side note, I also did a little research in it and discovered that there's a high number of black African Americans in the United States that are given that combination of drugs, cholesterol medication and high blood pressure medication on a level that's extremely high. And I couldn't figure out why. Why are they giving these? Why is it that black people get these high cholesterol and high blood pressure medicine more than anybody else? And then I also discovered that the results of using these two combinations usually sometimes culminates in a degeneration of the liver and the kidneys, so they end up on dialysis. So that combination, and I talked to a couple of people that never had any problems with their kidneys, but when they started that combination of cholesterol medication and blood pressure medication, they ended up having kidney failures and they end up on dialysis. So that dialysis situation is a big money operation that's going on in the country. And prior to let's say 1990s and early 1990s, I never even knew about these big major dialysis companies, but now they have dialysis companies that are mysteriously popping up everywhere, along with those companies, those pain management places that were getting people ridiculously hooked on opioids. So the thing is, where I'm going to is this combination. So there are natural ways of lowering your cholesterol. There are natural ways of lowering your blood pressure. So I suggest that if you need to have that and you need to do that, you really need to focus on trying to use these natural remedies instead of getting, on these pills, because especially the blood pressure medication is something that once you start taking it, they want you to take it for the rest of your life, rest of your natural life. So, hey, it is what it is. Do your research on that. I've done mine, and the conclusion that I came out with is that combination of blood pressure medication and cholesterol medication is the definite killer of people in that combination, especially black people.
KP's Video News.